Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Jennifer Curry, an employment lawyer in Maryland, about the many COVID-related issues that have emerged for employers. Let's listen.
Jennifer Curry, thanks so much for being with us.
Thank you for having me. It's a pleasure to be here.
So you're an employment lawyer. What has your life looked like since the pandemic began?
Well, that's an excellent question. Like a lot of people, I am working from home almost full time. I don't go back into the office as often as maybe I would even like to, but I'm working entirely from my home office with my two children down the hall. And, my practice used to consist primarily of litigation and advising employers on employee issues outside of litigation, but mostly litigation. And with the courts closing and litigation slowing down, my practice has moved significantly into working with employers during the pandemic and how to handle all the variety of employment issues that are cropping up on an almost daily basis. So that's really what my life has looked like, I would say, over the last 5 months.
Mm-hmm. And what would you say is the top issue you're dealing with?
So there's really two, I would say. The first would be dealing with leave for employees and figuring out how to deal with employees who are either sick or who are taking care of someone who is sick. And then second is employees who have children and dealing with school closures, daycare closures, not having childcare available, and having to work with employees who have children who are either learning virtually or they're just taking care of their children at home while they're also trying to work.
Mm-hmm. Let's talk about those folks. What is happening in terms of employers who are dealing with these parents like myself who are working at home, but also have children at home who need some attention? What sorts of avenues are employers taking?
Well, there's a few different options. And I just want to back up. One of the major pieces of legislation that was passed this year as a result of the pandemic was the Families First Coronavirus Response Act. And that included emergency family and medical leave, as well as emergency paid sick leave for individuals who are unable to come to work or unable to telework because their children are either home from school or daycare due to the closures as a result of the pandemic. And so for the very first time, employees at the federal level were getting paid leave for childcare. And that law was really passed with the expectation that we would not be dealing with school closures and daycare closures going into the fall of this year. And so the employees under that law were provided up to 12 weeks of paid leave for being able to stay home and take care of their children and to virtually teach their children if necessary, things like that. Now that we're moving into the fall and schools are either deciding whether to reopen or to continue with distance learning, a lot of employers are trying to figure out how to continue to work with employees who need to take care of their children. Some employers are actually implementing classrooms for their employees to bring children who are virtually learning in every day, whenever they're scheduled to come in, and provide some type of oversight of the children. But the children would bring their devices to the work site would be sitting in an area where they could be watched, but also able to do their schoolwork. Other employers are having to figure out for the first time, or at least for the longest time that they've ever had to, how to deal with employees who are teleworking and trying to be flexible. Both the CDC and OSHA has indicated that employers should try and be as flexible as possible with allowing employees to telework where that's appropriate. And I recognize that there's a lot of jobs out there that teleworking is not necessarily something that can be done, but where it can be, employers are being encouraged to be flexible with that as much as possible, which then brings a whole host of other issues for employers. For bringing children onto a work site, it's thinking about any liability issues that might involve, particularly where, the employer has never dealt with children on a work site before. For teleworking, on the other hand, employers should have a teleworking policy that outlines what their expectations are for their employees. And that includes, how to properly use the equipment, what happens if the equipment is damaged or misused in some way, and also just their expectations for what, a person working from home and their day is supposed to look like. So, there are limited options right now for employers and dealing with employees who have work and daycare issues, but it's obviously going to continue developing as this goes forward, because we've never had to deal with something like this, in our lives.
Right. So what about, as more and more places do open up, I guess we open and we close, but as more places have opened up, what about people who are afraid to come into work because of fear of the virus?
Yeah, and that's a good question. That actually has been a major issue, I would say, throughout the pandemic. And one of the things I can say with 100% clarity is that there is no protections for employees who are afraid of coming into work. There are clearly protections under the Americans with Disabilities Act for individuals who have a disability, who need an accommodation, and particularly in this instance, if they are in one of the high-risk categories that the CDC has identified of individuals who are at higher risk of contracting the disease or becoming significantly sick or ill from the virus, I should say. But, there is nothing out there that protects individuals generally from having to go into work due to fear. And one of the other major pieces of legislation that was passed back in March was the CARES Act. And the CARES Act is what provided the additional unemployment benefits to individuals who lost their job due to the pandemic. But that also included benefits for individuals who were unable to work because they were sick or because they had childcare issues. And so those benefits were provided by both the state and federal government. Some benefits were additional benefits. Obviously, we've heard a lot about the $600 additional pay that expired at the end of last month. That was paid out by the federal government. But otherwise, the unemployment benefits generally are still governed by the states, and whether the state is really the one who decides whether or not to grant an individual's unemployment application. And so for individuals who chose or choose not to return to work due to fear, the guidance from almost every state that I'm aware of indicates that individuals who have a job available to them and who are able and capable of working are not going to be eligible for unemployment benefits. But in practice, what I have seen is that there are a lot of states who are being significantly more favorable to employees than what you might expect based on that guidance. And so I've seen a lot of states who are still granting unemployment applications or unemployment benefits to individuals who are applying for it, even though they have a job available to them and they lost that job or didn't return to work because of fear. So that's something that I think both employers and employees probably are going to have to keep in mind as far as individuals who are fearful of coming back to work and losing their job because of that.
Mm-hmm. I'd like to switch gears, so we don't have a ton of time, but I know that you advise independent schools. And we had a controversy here in Maryland last week where one of the counties decided that no school of any kind should open, and that there was a lot of pushback from these independent schools. And in fact, the governor reversed the decision of the local group. What are you telling independent schools about safe opening, and can that be done safely?
Sure. I think the major difference between independent schools and major, large public school districts is that these independent schools are much smaller. They have a much more controlled environment for figuring out how to keep kids distanced and safe, and also keep their staff distanced and safe. And so I've been working with several different independent schools, both in Maryland and throughout the country, in preparing plans for how to get students into the door, what kind of testing and screening needs to be done, what kind of health suite should be set up for individuals who become sick or start showing symptoms of the virus while they're on campus. And then also, ultimately, what happens when you do have a confirmed case that's been on campus. And I'm not obviously a public health professional, but my recommendation to all of my independent school clients has been that you should be expecting not only when a case or if a case comes, but when a case comes, and that you will probably be lucky if you only get away with one this coming fall. So, the guidance from the CDC at the beginning of the pandemic was that schools should shut down for 2 to 5 days at a minimum, and coordinate with the local Department of Health to determine how and when to reopen. That guidance from the CDC has been lifted, and now it says schools should only close for up to 24 hours or close off the area that's been infected for 24 hours. My recommendation to schools is to not rush reopening once you have a case, and that from both a safety perspective for the students and their staff, that I still think it is best practice for them to close at least 5 days to get a handle on what the situation is, whether there is a major outbreak, how to clean, how to maybe reassess what may have led to the case coming onto campus, and to also give them enough time to do that analysis in light of the fact that our departments of health are being overwhelmed by all of the work that they're having to do and might not be able to help the school as much as we would have hoped for at the beginning of the pandemic. So I think, recognizing that school closure is going to be a way of a life and should be an expectation throughout the fall semester is really where I've been guiding my independent school clients through the reopening process.
Jennifer Curry, it's been a pleasure. Thank you so much for joining me.
Thank you so much. It was a pleasure being here.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.